Hello, Don here. Welcome to Podiatry Practice Mastery, where we help bring your practice to the $2 million mark and beyond. If you guys haven't downloaded, I do have a new $1 million practice formula. You can get it at podiatrypracticemastery.com. I'd like you to check it out if you haven't downloaded it, even if you have to download it again, because I want some feedback. That would really help me. Okay, I want to talk a little bit today about an experience I had with my dad. My dad, I think as I've mentioned before, he's dealing with some dementia. He's living locally, and I get the opportunity to go to doctors with him. And I always like to look at any experience and see what I can learn, kind of what worked, what didn't work, and what I would do different. So that's what I wanted to share today from an experience of going to see an ophthalmologist. So the first thing with the ophthalmologist, certainly they made the appointment pretty easily. I showed up with him. Paperwork was paperwork. I think it would have been a little bit better to do it digitally, but everything was on paper and I just filled it out. Well, I really was impressed with the medical assistant because they did all these initial little exams where they look in these machines and get the prescription, and they actually did all the stuff that an optometrist would do, I feel, doing the whole eye exam. So this really freed up the ophthalmologist to do some more in-depth retinal work or corneal work. So I the kind of the takeaway to that is there a way that we can have our staff do a lot more? I think our staff already do x-rays. Mine do not do ultrasound. I guess they could just as easily, I could teach them to do an ultrasound as well and mark things on the ultrasound. I could have them do the shockwave. I could have them, which they don't do for me currently. So they do the nails already and things like that. So just what other activities can we give to them so that we can do the things that only we have to do? Next thing was that they did well was they recommended a 1-year follow-up. And I was thinking to myself, I do not have patients come back routinely for 1 year. I just have them come back as needed. But I think having these ticklers, even for a 1 year, 10-minute slot, would be a good way to have everyone come back in 1 year just to see how they're doing, to see if there's any changes, not just for orthotics, but everything. I think that would be something good. Some things I didn't like and so kind of some fixes. The doctor kind of used some big words. I knew the big words because I'm in medicine, but kind of simplifying, I was thinking if I was my dad, he wouldn't even know what's going on. So they used big words and very kind of abrupt. And the other thing I didn't really like is that he felt like both him and the assistants, they just did things without telling us. Not even that I wanted to ask permission, but I wanted to know what was going on. And this goes back to this topic I've talked about before called a running commentary. I think if we just kind of have a comment as we're doing things, kind of the same way you would do things and teach a resident. So kind of doing the things hey, I'm doing this refraction of your eyes. I'm putting something to dilate your eyes now. I'm doing this so I can see better into the back of your eye. I'm doing this exam now to look at the pressure inside of your eye. Maybe he gets tired of it because he does it 500 times and it was the end of the day. And I feel like he was probably rushing because it was the end of the day. And in the end, all my dad got was eye drops. But it was kind of the whole experience of, I think this running commentary could be beneficial. So this is something that, as we're looking at x-rays, for example, we look at the x-rays and we just say, and the patient's wondering, what the heck's going on? Is my foot going to fall off? Same thing when we're examining the foot. We're like, oh my, look at that. And they don't really know what we're looking at. So doing a running commentary, kind of what that is, why they have it, and then what they can do about it is something that I've learned and that kind of helps with treating patients. So doing that more. The other thing I noticed is that they work a little bit rushed. So I think, rushing, it just felt rushed. Maybe just because they have to do so many different types of exams and they documented it. And then the last thing is he didn't have a scribe, so he had to document. He had ModMed as well, and so he was documenting the whole time in ModMed. And I think that's one of the benefits that I can do differently, or if you have a scribe, or even maybe the AI scribe, but you can document to them and say what's going on. And I think that saying or that speaking is kind of like the running commentary. So you could say, hey, this is what I do. Say, hey, I'm going to talk to my scribe and give a running commentary, and this will benefit you as well. So these are kind of my thoughts on a visit to the eye doctor. Once again, if you found this beneficial, let me know. Shoot me an email, Don at podiatrypracticemastery.com, and get my $1 million practice formula on the website. Okay, well, talk to you soon.